Well, good morning, everybody. It's 10:01, so I'm gonna go ahead and get started. I think my new goal is gonna be to find like elevator music for Zoom or really good like soul, like any kind of music. I really just music because it's driving me a little nuts. So I just want to welcome everybody and to our presenters. Thank you so much for being here. I will continue to be letting people in on Zoom. Um, we had a lot of people sign up, so I'm hoping that people aren't having technology problems. But just in full transparency, we are going to be recording this and then making it available to different communities, different church groups, people who may want the information later on. So make sure that that's okay with everybody. But as we go through, I'm going to let our presenters share with us what their comfort level is as far as asking questions as we go. But the whole intent for today is to really bring local information from experts in your community to make sure that you can have all of your questions answered, know what services are available, and know that there are people here to serve us like locally and meet our needs. So our public health department has been outstanding as far as making themselves available to groups like this. The whole team in public health has truly wanted to bring information into people's homes and their communities, and so thank you. So I'm excited. So let me introduce myself. I have a silly name. You're welcome to giggle. I married the man, so it's my fault. But I am Tracy Stacy. That was never my intention in life, but here I am. And so I actually I'm proud to work with a company called Choice in Aging. We're a local nonprofit, and we actually are funded. Our program is called the Prevention and Early Access for Seniors Program, which is way too many words. So we affectionately call ourselves the PEAS program, and we're funded through the Mental Health Services Act. So we're a unique community support program for older adults, 60 and older, and we help people improve their quality of life, stay safe and healthy in their communities, as independent as possible for long as possible, make sure that they have access to resources. So I feel like I have the coolest job ever because our whole intent is to um, reduce problems for people. So it's really cool because in our older adult community, we know that the aging process in general, there's a lot to consider and navigate on a day-to-day basis. And so to offer support is a blessing to us. But some of our case managers are here today, but our case managers truly do anything that anyone needs, from helping with navigating Social Security, Medi-Cal, Medicare, TRICARE, SSI, any public programs, the VA, housing, which is always stressful, especially everywhere, but here, and just helping put things in place again to hopefully reduce stress, reduce anxiety, reduce isolation, create connection. And then on top of a free case management program, we have an LCSW on staff who his whole job is to provide mental health support for people in their homes in the community. So people who may be concerned about the stigma of traditional therapy, who wouldn't want to go to an office but don't mind sharing a cup of tea or coffee with a friend, we'll let him come and help them maybe process grief, deal with their anxiety, make sure they're going to their doctor, those kinds of things. And so it's all free. We have no income requirement. I think we're the luckiest program in the whole county because we know that mental health doesn't discriminate based on income. So we truly don't care if you have zero money or tons of money. We will help you where you are and help you, get to the best place possible. And you only have to be 60 and older and say we're willing to accept help. And for the most part, we can help you. So I do have the coolest job ever because I get to bring information into the community. I'm the education and outreach person. So I will give you information later on because one of the things that we're doing currently is we're making sure that seniors in the community know where to get their shot if they want to get vaccinated, how to get it, if they need transportation, if they need support, if they need to know if they're Kaiser, if they have Medicare, maybe they go to Sutter or Hill's Physician or La Clinica or pick, wherever they would normally get their medical care, will help them figure out where to get a shot. And then with all the county opportunities as well, how they can get their vaccinations and any other, support they might need. So I'll make sure that our contact information is available after. So I'm going to turn this over. Oh, just a moment of housekeeping. In everybody's screen, if you go to participants, there's a box that's called chat. So should you have a question and you're not comfortable maybe asking it out loud, you are welcome to put it in the chat box, and I will make sure that our presenters see it or ask the question for you. You're also welcome. There's a little hand icon. You're welcome to raise your hand. I will be monitoring to make sure. And then we'll just let our presenters tell us what will work best for them as far as when we should be asking questions. I'll put that over to you guys. And we'll go from there. But since I expected a few more people, but this is a really great group, so I like this number. So really, I'm hoping that you are all get comfortable enough to ask any question you might have. I promise you, if you are thinking about a question, somebody else is probably thinking it too. So I will invite you to maybe be brave or to speak out, because I'm sure whatever you need to know, others need to know too. So take advantage of this opportunity. So I will turn it over to Robertson and Dr. Fuller, and thank you.
Great. So good morning, everybody. And I just wanted to say thank you for allowing us to come into the space. And I recognize a few familiar faces, so I just wanted to say happy to be here and good morning. My name is Dr. Fuller. I'm a Deputy Health Officer for the county, primarily over the maternal child and adolescent health program. I'm also a pediatrician and a co-facilitator for a community group called Solano Hills, which stands for Health Equity for African American and Black Lives. And so today we're going to be talking about COVID-19 vaccine and hopefully try to answer some of your questions. And I will turn it over to Robertson.
Hello, everybody. My name is Robertson Somoa. I'm a Senior Health Education Specialist for the Communicable Disease Program for Solano County Public Health. And I'll be co-hosting with or co-presenting with Dr. Fuller and just cover a lot of the information and a lot of the questions that you may have about COVID-19, the vaccination, the rollout, the tiers and everything. Right. So I'm excited to do this. So today's agenda, we'll be going over the historical and cultural context of the reasons why there's mistrust against the COVID-19 vaccine and just mistrust in general within the public health and healthcare system among specific groups, specifically the African American community. And we'll be covering COVID-19 and its impacts on the African American or Black community. And we'll be talking about the immune response and vaccines and what makes the COVID-19 vaccine unique. We're going to just clear the air about the vaccine itself, as in like some of the misconceptions and myths surrounding the vaccine and the role of the vaccine in this pandemic. Then we'll also go through the phased rollouts. We'll explain as to what groups, age groups, and professions are qualify at what time to receive the vaccination. And we would ask you to just type your questions in the message box in Zoom. And when we are done with the presentation, we can just go over all those questions. So we're just gonna begin right now. So when we talk about the historical context, there's a lot that has happened in the last few hundred years, specifically in the last 100 within the African American community, whereby it's created this mistrust when it comes to medical practice and public health within that community. One of the more famous scenarios or in history was the one, what we call the Tuskegee Experiment, whereby it was the longest running non-therapeutic experiment on humans in US history. It was the subject of the experiment were 399 men with syphilis who were promised medical care and burial insurance to join the study. Initially, it was supposed to be a 6-month observational study, but it ended up being much longer, about 40 years. And there is a lot that went wrong with this study. This was an insidious approach whereby there was a partnership with the Tuskegee Institute and a partnership with Black doctors, Black public health nurse, Black trainees, and the faith community. And what happened is that in the first 10 years of the study, we discovered penicillin in 1945, which could have being a therapy that could have cured these men and their families of syphilis, but it was withheld. No participants were offered this therapy, and the study continued. And this continues to have an impact, and mainly with trust within the community. And this wasn't a one-off event. There's a book called Medical Apartheid that I put a screenshot here on, and it just covers just the history of these things happening within communities that are considered other or minority. And that has just created this history of mistrust. And there also are other contexts whereby individuals going into the emergency room seeking for this services, such as having high blood pressure or having some heart conditions, and not necessarily being seen immediately or not being given certain procedures as they were in the emergency room. And what they found was that when the people who were seeking the help were usually people of color, African-American, Asian, if they didn't have insurance, if they were women, that had an impact on the kind of services that they received or the time it took for them to receive those services. So we want to acknowledge this. We want to acknowledge that this mistrust is not coming out of nowhere. It's been something that it's a result of history. And we need to establish trust with the community because especially with the new COVID-19 vaccine, there is this quickness to want to vaccinate people. However, there's been kind of some limitations with getting people tested, especially people within the African-American community and other minority communities. And also that there's not enough vaccine for everyone. There are different vaccines from different companies. So all this creates a little bit of confusion. So we want to use this as an opportunity to clear the air and just address some of these misconceptions so that you leave this presentation guarded with or armed with information that will make you or allow you to make a good decision. There's this doctor called Dr. Kidsmaker Corbett. We have another slide that kind of breaks down or goes a little deeper into what she does. And basically, I'll just give you a quick overview. She's one of the lead scientists for the National Institutes of Health, who was responsible for the vaccine research. And she was fundamental in putting together a lot of the information and research around the vaccine. And she has something very poignant to me, I feel. It says, "You've earned the right to ask the question that you have around these vaccines and this vaccine development process. Trust, especially when it has been stripped from people, has to be rebuilt in a brick by brick fashion." And she's going to do her part in laying those bricks. So what we also going to try and do is just break down some of the science behind the vaccine and some of the misconceptions so that you can make a right decision about the vaccine. Dr. Fuller?
Thank you, Robertson. So just to go over a little bit about what COVID-19 vaccine is, it is caused by the novel coronavirus SARS-CoV-2. And coronaviruses we've known about for a very long time and have been actually studying for a very long time. The coronavirus is called that because, as you can see, it has this like crown-like spikes on the surfaces of it. And so that's where it got its name. And viruses in general, they change through mutations over time. And new variants are always are emerging. And so, and we're seeing this with COVID-19. And you may be aware and have seen some in the news that there are some even variants as we speak on from the COVID-19 virus itself. We identified some in the UK, which was spread a little bit more quickly than other variants. And then there's also some variants in South Africa as well as in Brazil. And later on in the presentation, we'll go in a little bit more detail about viruses and how they infect you, and also the role that vaccines play in protection. But before we do that, let's go to the next slide. And we're gonna, in this next few slides, talk about what we've been seeing that COVID-19 and its impacts on the African American and Black community in particular, because we've been seeing African Americans be adversely and disproportionately adversely affected by the COVID-19 virus. This slide shows you different areas throughout the country, different states and different cities. And on the left side of the graph, it shows you the percent of population of African Americans in that particular area. On the right side, it shows you the death rate from COVID-19. Now, if COVID-19 affected everyone the same, like, I don't know if you remember last year, it was called the Great Equalizer, because it was a virus and people thought, okay, well, everyone's going to be pretty much, you can't escape it. Everyone's just going to be affected. Well, we know now that that is not true, and that Black Americans have been affected quite to a great extent, much more, especially in death. So, so if it was true, this line should be straight across. But we're seeing in places like Milwaukee, where there's 20% population of African Americans, but then it's 73% death rate. And the same thing is true in other places like Louisiana, Michigan, Chicago. And if we, fast forward to today, we're still seeing that the death rate is disproportionately impacting African Americans. So let's look at the data in Solano County. If we look at the next slide, this is the death rate by race. And of course, we can only look at the areas that actually disaggregate the data by race, which is so important to do. So here in Solano County, we do disaggregate data by race. And you may not be able to see it because it's pretty small on the bottom, but I'll read it for you. So on the left side, we're seeing Asian and Black Americans with a very high death rate, especially compared to the next two bar graphs, which are Hispanic and white. And then the highest is, of course, is multicultural or mixed race. So let's look at why this is true in the next slide. And so when we think about this, and we think about our systems, and we're thinking about just health in general, what COVID-19 did, it didn't cause this disparity, and it didn't cause this gap and disproportionality. What it did was it highlighted the brokenness of our systems. It highlighted the unfairness of our systems and areas that we need to change and fix. And so as Robertson mentioned early on, when we're thinking about like the Tuskegee experiments and multiple things that have taken place in history that just was unethical, we also need to think about like how this country was founded and created, and that this country was built on a system of oppression. And so it's not that the system is broken, because the system gives us outcomes that the system was designed to do. So what we're seeing is just a direct reflect of how the system was designed. And what we need to do, though, is go back and break the system and fix it. So when we're talking about like systemic racism and really racism on all levels, we need to go back and look at how that is influencing what we're seeing today. So let's look at the next slide and kind of delve a little bit deeper into this, and specifically looking at COVID-19. So if you look on like the CDC website, you'll see that in research, we're seeing basically three buckets of why we're having such high numbers of death from COVID-19 in the African American community. One being environmental inequities, wealth inequities, and underlying health conditions. So if we're looking at environmental inequities, some things that contribute to that are things such as crowded living spaces. And if we're thinking about looking into why we're seeing multi-generational living in our communities of color, a lot of that has to do with just cost of living and wealth gap, and just that in order to survive and to be able to afford rent, you need multiple streams of income in that household. And so then when we ask people to social distance or to isolate, it's very hard to do if you have multiple people in a small space. And then also if you're thinking about, building health and your immunity so that you can fight off any type of virus, one of the main ways to do that is your diet. And we're seeing food deserts. And so if you're in Solano County, and especially in areas where there's people of color. So if you're asking people to eat fruits and vegetables, but then you don't have access to healthy fruits and vegetables, it's very hard to do. Also, in this county and in the nation, we're seeing overrepresentation of especially Black men in prison and mass incarceration rates. We're seeing police violence unfold in front of us in our phones and social media. Not that that was new, but in 2020, we had a front row seat to see this. And in fact, yesterday was the anniversary of Ahmaud Arbery's death. He was a young Black man who was running through his community, his neighborhood, and was gunned down and killed. And when you think about that and the tragedy of that, it not only affects him and his family, but it affects all of us. And it can cause a great amount of stress and trauma. And all of that plays a role on your health as well. Then again, if we're looking at wealth inequities, then we're looking at the wealth gap. As I mentioned, our systems were based on a system of oppression, and that this country profited off of slavery, off of free labor, and no retribution for that. And so we see a lot of people of color working in the front lines, whether it be like grocery stores, whether it be, just any type of service. And we know that when you're in the front line, then that is going to cause your exposure to COVID-19 to go up. And not only are you in the front line, but you also aren't afforded the opportunity to be able to work from home, have sick leave, and all of those things come into play. And then lastly, underlying health conditions. So we already have existing health disparities before COVID-19. And then, as Robertson mentioned, talking about the mistrust in the healthcare system. And how I like to frame it is that it's abuse of trust from our healthcare systems. It's an abuse of trust from our health providers, from our public health systems, and from the people that should be trustworthy. And so when Robertson says that, we need to build trust, it's absolutely, paramount that we make actionable steps and real steps to do that, because we owe it to our people and we owe it to our community. And then we also need to address the bias that's in healthcare. Robertson gave great examples about how, when you go into emergency rooms and things like that, if you're a person of color, especially if you're a Black person, you're more than likely to not be taken seriously for your pain, not be taken seriously if you're coming in for any kind of cardiac problems. And then that contributes to this underlying health disparities. So when you look at all of that and put it all together, it's not just a problem of this virus, right? It's a problem of our systems, and it's a problem of the underlying racism in our systems and how to dismantle that and go against that and be anti-racist. So let's look at the next slide. And so now that we have kind of a clear picture about that, let's talk a little bit about, you know, what is happening now, and that we have developed a vaccine that's out there, and how does this vaccine work? So disease works is how it works in your body is that you are faced with a pathogen. A pathogen is an organism that causes disease. And so when it enters your body, it alerts your immune system. And the really cool thing about our bodies is that our immune system has a way of remembering when something foreign enters it. So the first time it enters, you know, it's like, what is this new thing that's coming into my body? And then it kind of builds up its armor or its immunity. And so then it's able to attack it. The thing that vaccines do is that it's able to trigger that immune response without you actually being infected with the pathogen. So it can mimic the pathogen, and it can trigger that immune response, and so that you can build up this immunity or these antibodies, so that when you do actually come in contact with the real disease, you already have your ammunition to fight against it. And so let's look at that in the next slide, just a little bit more of a kind of graphic cartoon depiction of it. So if you think of it as like a detective that's seeing this foreign body that comes in, it's like, okay, again, like, what is this? And so then your body attacks, and then it remembers what it's seen. So then the next time it comes, you're presented with that foreign body, now it has the ability to fight it off much better than it did before. Now, in the next slide, so you might be asking, then why don't we just build up natural immunity? Why do we need a vaccine? Well, it takes time to build up immunity. And also not everyone has a strong immune system. So again, if you have underlying health conditions, if you have a weakened immune system, if for any reason your immunity is weakened, then you might not be able to build up enough of that fighting power or enough of that immunity to be able to fight against this pathogen that's entered. So that's the nice thing about vaccines, is that it can trigger that immune response without causing the disease.
Thank you, Dr. Fuller. And just to add to what Dr. Fuller just explained with the COVID vaccine, we know that vaccines work. We've had the development of different vaccines throughout history, and these vaccines have fought diseases such as smallpox, diphtheria, measles, mumps, rubella, tetanus, polio, what have you. And the graph here is, I think, very self-explanatory, and it's a perfect example of what we are trying to explain, that let's say in the early 1900s, the annual US disease cases for a lot of diseases that we take for granted today, such as measles, pertussis, mumps, rubella, diphtheria, tetanus, polio, smallpox, influenza, they were significant. For example, and for measles, you just take that one, there were 530,000 cases. Pertussis, there were over 200,000 cases. Then you compare the early 1900s to now, or like within like 2010 to now, a lot of these, for example, the measles that in the early 1900s was over 530,000. You have 61 cases as compared to that. You have pertussis reduced from 200,000 cases to 21,000 cases. And what's rubella now? There used to be about 47,000. In the early 2010s, there were only 6. So what this basically tells us is that these vaccines work. They have a way of reducing the disease impact in our population. So the more of these vaccines are out there, then a significant reduction in the number of people who get these diseases. And we're trying to do this same thing for COVID by introducing that vaccine into the community, into the population, to reduce our significant numbers. So what makes COVID-19 vaccines unique. There are different types of COVID vaccine. I mean, there are different types of vaccines available. Most of them are weakened or inactivated versions of a pathogen or specific parts of the pathogen to trigger the immune response Dr. Fuller was talking about to produce the antibodies to fight the disease or the virus or the bacteria. The 2 COVID-19 vaccines approved for emergency use in the United States currently use what we call messenger RNAs. These contain instructions on how to make the spike protein that Dr. Fuller was talking about, that is on the external part of the virus that's seen in the novel coronavirus. The immune response is triggered when it detects the spike protein, but the body is not exposed to the live virus. It is not exposed to the full strength of the disease, just the protein. And now our immune system is able to memorize what those spike proteins look like so that the moment it sees an actual virus, the next time it's already built the army ready to completely obliterate the virus. So it doesn't now need to kind of have to muster up the immune responses. We are ready to go and be able to destroy it. And so there are a few misconceptions about the COVID-19 vaccine. And well, a few is the wrong word for it, there's a lot. But we're going to tackle some of the main ones that seem to be pretty prominent. One of them is, I heard mRNA vaccines are new and have not been used before this pandemic. That is false. Though mRNA vaccines are new to most people, they are not unknown. They have been studied for decades and have been used in early stage clinical trials for influenza, Zika, and rabies. The second one is the vaccine is going to change my DNA. I hear that a lot, especially within the African-American community. And the response for that is false, it's not true. The COVID-19 vaccine mRNA does not enter the nucleus and does not affect genetic material. The COVID-19 mRNA goes into the ribosome. That's where the proteins are made, which is located in the cytoplasm, which is inside the cell. So basically, the mRNA disintegrates after it's done its purpose of kind of informing the immune system that this is what the spike proteins look like, and this is how you should muster up. This is so that you can muster up the immune response for it. So after it's done with its job, because it's just made up of a series of proteins, it just breaks down because it has no purpose after that. So, and it just disintegrates. So it doesn't go into your DNA and change anything. The third one is the vaccine is not safe because they rushed to approve it for use. I hear that a lot, which is false. Like all vaccines, the COVID-19 mRNA vaccine has been rigorously tested for safety before being authorized for use in the United States. So one person that I want to highlight here is Dr. Kidsmaker Corbett. She, in the earlier slide, she made mention of the importance of us to kind of delve into the information that is out there about the vaccine and the vaccine process of development so that we can kind of like have a pretty solid knowledge about it, which will guide our decision making. And she made mention of the need to kind of like allay all those fears in order to get this vaccine out there. A little bit about her is that Dr. Corbett is a viral immunologist and research fellow at the Vaccine Research Center at the National Institute of Allergy and Infectious Diseases for the NIH, or National Institute of Health. She leads a team of scientists working on the COVID-19 vaccine, or who worked on the COVID-19 vaccine. She played a very pivotal role. And as an African-American woman, she is part of our community, and it's nice and great to see one in our community doing so much to help in a viral pandemic that has decimated so many populations in the world and in America. Dr. Corbett also says that she's a Christian, she's Black, she's from the South, and she's an empath, and she wants to use her role as a scientist as a way of giving back to the world. And I'm very, very excited to have somebody like that in vaccine research. So a few of the other misconceptions is that the vaccine is going to give the person COVID. It's false. The vaccine does not contain a live virus and cannot cause the COVID-19 disease. It takes a few weeks for the immune system to build up its defenses after vaccination. However, you can still get sick just before or just after the vaccination if you are exposed to the virus itself by someone else you live with or someone in your community. So if you get sick, it's your exposure right before your vaccine or right after the vaccine, before the vaccine is able to kind of help you build your immune response or your basically the ability to fight COVID. So the vaccine has fetal cells. That's what a lot of people say, and it does not. That's false. The vaccine does not contain any fetal cells. Both the Pfizer and Moderna vaccines contain mRNA, lipids, salts, and sugars. The Moderna vaccine also contains acetic acid.
I can't, because when I go in there, I don't.
The emergency use authorization fact sheets for Pfizer and Moderna vaccines are available online in different languages for those who are interested in reviewing it. And I would suggest that you take a look at it so that, and we have also links in this presentation that we can send out to the participants so that they can actually view it themselves so that they can allay a lot of their fears. So what is the role of the COVID-19 vaccine in the pandemic? So the vaccine could potentially reduce the number of people who develop COVID-19 disease. And even if you get the disease, it reduces the severity of the disease. That's a very important point. So instead of its COVID-19 being so serious that you have to be in the hospital for a number of weeks or months, or it potentially killing you, it does not do that. It reduces the severity. It reduces hospitalization rates overall in the population. It reduces the number of deaths. It shortens the length of the pandemic, and the impact state and local health orders and restrictions currently in place. So the more people who get this vaccine, the earlier this pandemic will end. That's why it's so important for us to make an informed decision so that we can get the vaccine, so that we can reduce the numbers and we can get back to some level of normalcy. So another role of the vaccine, the COVID-19 vaccine in this pandemic, is that the vaccines work best if the majority of the community are protected. The duration of the immunity following vaccination is currently unknown. More information is needed about how well the COVID-19 vaccines will work in the real world. And but even if you have the vaccine or you get the vaccine, we still recommend that you continue to wear your facial coverings, you frequently hand wash, you maintain that social distancing or physical distancing from others outside your household, even if you are vaccinated. So what is the efficacy of the COVID-19 vaccine? I will pass it over to Dr. Fuller.
Great, thank you. So according to the CDC website, Moderna vaccine was 94.1% effective in preventing laboratory confirmed COVID-19 illnesses, and that was after the second dose. And the Pfizer vaccine was 95% effective after the second dose from preventing COVID-19, which are both really good and really high percentages for vaccine effectiveness. And we can go to the next slide. So another common question or concern is like the possible side effects from vaccines. Any vaccine that you have has possible side effects, and COVID-19 vaccines, the two that are out right now, are very similar to other vaccines in their side effect profile. So it can include things like pain, fever, fatigue, headache, kind of like muscle pains, aches and pains, just a general not feeling well, and even some swollen lymph nodes are common. If you're going to have a reaction, it's usually within that first 2 to 3 days, and the side effects usually only last a couple of days if you do have one. And most times when you get the vaccine, they usually have you sit and wait for about 15 minutes just to see if you have any immediate reaction. Yes. And so I've gotten the Moderna vaccine, and I will say that before I read on the Moderna vaccine and all the vaccines and sat through multiple webinars and things like that, I was hesitant about getting a new vaccine. But I did look at everything and weighed the benefits and the risks for myself. And I felt that this was something that I really needed to do. And so I got the vaccine. I got my second dose probably about 2 weeks ago. After the first dose, I had a little bit of swelling in my arm, a little bit of soreness, and just compare it to, like, let's say I get the flu vaccine every year, and I usually get some soreness in my arm. With the Moderna vaccine, I had a little bit more swelling. And that was about it after the first dose. The second dose, I was prepared to have to expect more of an immune response and maybe more side effects, which I did have. And so after I got my vaccine, I actually took some ibuprofen, and that helped with like the body aches, because I did experience some body aches. I experienced some chills. I didn't have a fever. I think my temp went up to probably like 99. It may have gone up higher if I hadn't taken the ibuprofen. And all of it lasted a day and a half. So I was off that day. I kind of just rested at home. And after the second day, all of those side effects dissipated, and I didn't have anything else after that. And I know, Robertson, you also had the Pfizer vaccine, though,
I had the
right?
Pfizer vaccine. The first injection that I got, or the first shot that I got, it was just a day after I just felt a little bit of muscle soreness at the injection site, and pretty much nothing else other than that. However, the second shot was a little bit more different for me. The first day I had the shot, there wasn't much soreness. However, the next day I felt a lot of fatigue. I felt a little bit of fever, which kind of started to gradually increase from maybe like noon till about 3 p.m. And I had to take some ibuprofen. And after I took that, I basically went to bed. And when I woke up, all my symptoms were gone, which felt good. The next day, it was just as if I had not even experienced anything at all, and I was just back to normal. So I'm going to discuss the rollout of the COVID-19 vaccines for Solano County. So to understand how the rollout works, the federal government, California Department of Public Health, and Solano County Public Health the division play different roles in the distribution of vaccines locally in Solano County. First of all, the federal government allocates a number of these vaccines to the states, and they recommend phases and tiers that they want, or they recommend the states to follow. The state, on the other hand, allocate the vaccines that they receive from the feds to the counties, and they also look at what specific circumstances are around the state, what changes they need to make or add to the recommendations of the federal government to make it more useful for the specific state. So they give guidance for the phases, tiers, and timelines as to when the vaccines should be given. And then the allocations come to the county. The county store, distributes, and administer the vaccines locally. And every county is different. So the makeup is different. The resources are different. So the county will basically just look at the recommendations from the state and just formulate local guidances for phases, for tiers, and timelines. However, Solano County closely mimics or basically uses the guidance that the state puts together. So it's very, very similar, or in many cases the same. So phased rollout of the vaccine. Solano County closely follows the state's recommendations. Like I said earlier, the county is focused on coordinating an equitable distribution of vaccines to residents and employees in Solano County. Currently, the eligible phase and tier groups are based primarily on two factors: the occupations with high risk for exposure to the COVID-19 positive individuals, and also the age groups with high risk for severe illness if exposed and infected. So these are the tiers, the phase and the tiers. So the first phase, that is for phase 1A, tier 1, includes the ICU and ED emergency department staff. It also includes the COVID-19 unit hospital staff, acute care and surge staff, inpatient psychiatry facility staff, transport staff for the vaccine, dialysis center staff, vaccine administration staff. When all these received their vaccines, it moved on to the next tier, which is the phase 1A, tier 2, which is the home health workers, first responders, intermediate care facilities, including developmental centers, primary care providers, and ancillary support staff, IHSS workers. And then it moved to the next tier, which is the 1A, tier 3, which is senior 75 and older. And specialty clinics, lab workers in hospitals, dental, oral health clinics, mortuary staff, pharmacy workers, tiers, the clergy. When you see that green arrow, that means that these people are currently being given the vaccination. They're in the tier that currently qualifies for vaccination. And so the people you see here the tiers you see here have already had the vaccine or they're in the process of getting the vaccine currently. So the rollout, currently we are at the seniors age 65 to 74 with medical conditions. And for the next group that are going to be vaccinated are seniors age 65 to 74 without medical conditions. Then we are going to be vaccinating our educators, childcare staff, adult daycare staff, agricultural workers. Then right after that, we're looking at the jails and juvenile corrections, the homeless and unhoused individuals, transportation and logistics, including non-emergency transport providers, industrial sector, commercial and residential, food industry, and critical manufacturing. So the phase rollout for the vaccine, the 1C, phase 2, and phase 3 tiers, the plan, so this would include the general population. The plan is that we start in summer of this year. We start making sure that all these individuals get their COVID vaccine shots. And it doesn't matter what age you are. If you fit those tiers, you're getting it. All individuals who live and or work in Solano County and are interested in being vaccinated can sign up for the alerts online through the county COVID vaccine interest form, which can be found on our county website. We can also forward the link to all the participants when we are done with this presentation. And also, please check our website, the Solano County website, and just go to the COVID vaccine tab. It's right there on the front page. You see like a little tab that says COVID vaccine. Click it. There's lots of information in there about just the phases, the tiers, everything that you see today is updated on those pages. So please check it out. It's a great resource for you. And one other thing, if you have any general questions about vaccination rollout, when is your turn, just general questions that you're not sure of, please write this number down. It's called the COVID-19 warm line. The number is 707-784-8988. You can also follow us on social media and Instagram. But one of the best places to get information about the vaccine and the tiers would be our website. So this is our question and answer time. So we're ready to address that.
So Robertson, let me just say a couple things. I just wanted to make sure that people know, I have to say I have been so thankful that some of our low-income congregate housing communities that are really just 55 and older HUD properties, so maybe Section 8 communities who don't meet the criteria for assisted living or like congregate living with care, public health has worked it out to where they have brought their team to the apartment community in some in Vaccinel, Fairfield, Vallejo, wherever there's been a request, to make sure that any of the residents in those apartment communities who wanted a vaccine got a vaccine. So they really have, even though they have really been, tried to keep to the fidelity of the most at risk in the tier system, they have been absolutely responsive to requests and to making sure that people have access. So I just want to make sure that people know that you guys are doing that and say thank you. And then we did have a couple questions. I'm not sure, we can start with the questions in chat. And then if people also want to ask questions live, they're welcome to raise their hand. But one of the first questions that came through is, after receiving, I think it's from Alejandra, after receiving the vaccine, can someone test positive for the vaccine?
So do you want me to answer this? Okay. So most tests test for the actual virus. And so no, you won't be tested positive. Now, after getting the vaccine, now if you build up antibodies and you get a test for antibodies, then you may test positive for antibodies, but not for the actual virus.
Very cool, thank you. Did you have any other follow-up, Alejandra?
No, thank you so much. That answers it.
That was a good question. Yeah.
Thank you.
And then another question came through that said, after receiving, no, forgive me. So why does the second dose cause more side effects than the first? I've heard that a lot too.
Yeah, that's a really good question too. And it has to do with your immune system. And so the side effects that you're seeing is actually your immune system revving up. So the first time you get the vaccine, it's something new. So it has to take time for your immunity to build up and your immune system to get going. But that second dose, it's like, okay, we got it now. We've seen this before. And so then it spikes up your immune system. And so that's why you have an even bigger response. So actually, when you're getting the side effects, it's really, you can think of it like, okay, my immune response is really activated, which is a good thing, which is what you want to have.
So Dr. Fuller, I will say, and this is anecdotal, so tell me if it's just random, but in a lot of our senior community, in our older adult community, it's interesting. So in my sphere of my personal life, my 30, 40, 50-year-old colleagues, friends, family, their immune response is a lot bigger than my peers in my older adult life, where many of them have had pretty mild response, where they might have been fatigued or felt sluggish, but didn't have the same level of response as the younger people, which I had expected the opposite. So I don't know if that's an age thing or just totally random and anecdotal, or if there's any merit to any of the thing, because really overwhelmingly the older adults have reported that they've had a pretty good time of it.
Oh, really? Oh, that's good.
Okay.
Yeah. I mean, like, everybody's is it's your own personal body. And so, like, even mine's and Robertson's response was a little bit different. But so I think it just depends on the person. But that's the reason why you will get that response. That's because of your immune system. So yeah.
So age is irrelevant. So just hydrate and take
Yes.
Understood. Let's see. And then there's another information that came through. And Danette, feel free to explain more if I screw it up. But it says that Kaiser's offering vaccines to the next tier, but it's that these Solano County residents have to go outside of the county. I don't know if you know anything about that, or maybe why that would be happening.
I don't know, but what I can add is that the vaccine rollout, the number of organizations or facilities that get the vaccines is very limited from the state. Even though we are getting a certain number of vaccines, some of it is also going to certain pharmacies, and I think some of it is also going directly to Kaiser. So in many ways, we may not be controlling what Kaiser is receiving. However, I can look into that and find a response that is from our health officers and just get back to you, unless Dr. Fuller, you know anything about this?
No.
I know on other calls, Bela has said to people that if you hear, like if you're a Kaiser patient and you hear something like that, he's, really advocating that people, if you're ready and willing, to call your provider and ask that question, right? So if you have access, you can get it and then take advantage of that opportunity because of
Absolutely.
capacity of dosage, right? So I think some of what has happened is that no one wants to waste dosage. And so as they have come out, rather than waste it, if there's people that they can give it to, they can predict that they're going to get their 2-week cycle, right? And not waste a single dose. They are making sure that's utilized. So, and I will say, it hasn't been brought up yet, but I'm thankful for how things have been run because some people have been a little cranky here and there about like, well, why isn't it faster? Where is everything? Where's all the dosage? But our public health department is very mindful of not overextending how they are distributing and vaccinating people. They don't want people caught without having access to the second dose, right? So they are really, my understanding is that they're really managing how they're rolling that out so that people are fully vaccinated and there's no waste. And I don't know if you want to speak to that at all. No? Okay. But let's see. I don't know who this person is because it says an individual who has never had any medical conditions and has a strong immune system. Why should that person get vaccinated?
I can say something. Well, with a little bit of the reading that I've been doing and what I've come across, how COVID-19 affects individuals is different, and you never know how you're going to end up. You never know how your body is going to react to the virus. So to be on the safer side, it's better to have the vaccine and have the protection, and then rather than like risk it and possibly get it because you never get sick and may put yourself in a situation whereby you might get really sick from it or die.
Exactly. And then just to add on to that, you also don't want to pass it on to someone else. And that was a major contributor for myself getting the vaccine because I have family members who are extremely immunocompromised, and I don't want to bring something home to them and get other people sick. So it just helps build herd immunity. So even if you feel like you're healthy, it's still a good idea to do it for all the reasons Robertson said as well.
Then Ms. Henderson, Mary, I see your hand, so the floor is yours.
Okay, my question is, I have noticed in some counties there have been doses that have been wasted, and Solano County was not one of those counties, and I really appreciate that. But I want to know if at the end of your day, if you have doses that have not been used, is there a way people maybe not in that tier can call in and be vaccinated with those doses rather than wasting them?
Dr. Fuller, you want to go for it?
Well, I can tell you, and you may add to this, Robertson, but I know like for Family Health Services, we definitely try our very best and we haven't wasted any doses. And so even if, if it's not for that particular group, if it's someone, like you said, in the next tier or whatever, we will go ahead and give it as opposed to just to wasting it. But I don't know if you have, you may have more information, Robertson, about
the only other thing I can add is that some of the vaccinations that I've heard going to pharmacies, people basically have a way they can sign up for all these different pharmacies. They're on like a call list, and if these are going to be, if maybe the vaccine is going to be wasted, they tap into that call list and inform people who are on the list that they could possibly get the vaccine. So I know at least a few individuals who've been able to get their vaccination that way.
Thank you.
You're welcome.
Thank you, Mary. So Danette, you're going to have to help me with this if you're willing. But if I understand the question, it says that if a household where all of the family members do not want to get vaccinated,
True.
are
That's correct.
okay. Are those who are vaccinated safe? I didn't understand that part of the question. Maybe expand on that one.
Okay, sure.
Thanks.
Where there's a house, as I say, there's a household where there are family members living together, and all of the family members do not want to get vaccinated. So my question is, the ones who are getting the vaccine, are they safe from the other family members who do not want to get the vaccine?
Yeah, so the vaccines have about a 94-95% efficacy rate. So there is like a 5% chance that you could still get the COVID vaccine even with vaccinated. So it's not 100%, but it's definitely better than not getting vaccinated. So there is a small risk, but
Thank you.
mhm.
And then, oh, of course, my doggy goes. So if a person tests positive for COVID, will the vaccine work on them?
Yes. So even if you tested positive for COVID, it's still recommended to get vaccinated because they're still doing studies to see how long you'll have antibodies from natural immunity, meaning that you got COVID and you went that way and build up your immunity from that. And it doesn't seem to be as long of an immune response as if you were to get the vaccine. So even if you've gotten COVID infection, it's still good to go ahead and get the vaccine as well.
Thank you. And then the second part of that was, it was reported that after receiving the vaccine, some individuals contracted the virus again. Is there any data on that? So like what would cause that to happen? Or could it be different strains or just a fluke or?
So I think Robinson touched on that a little bit earlier. So there is some lag time of you building up immunity once you get vaccinated. And also if you were exposed before you got vaccinated, then you could have been positive, you could have been infected with COVID before you got the vaccine, or you could still get infected with COVID even if the days following the vaccine, if your immune response hasn't been built up yet. So that is the most likely reason why you're seeing these positives for the coronavirus, even after someone's been vaccinated, is because they were either exposed before or during that in-between time.
Okay, let's see. I'm looking for hands. Don't be shy. If you have questions and you've hung around, please speak up. Give you a minute to anybody. So are you, I will then ask, go ahead, Alejandra, speak up. Please.
Okay, thank you. I didn't want to interrupt on anybody. I just, I really appreciate the entire presentation, especially from the very beginning, because it gives us really real context to everything. So my question is, what is Solano County doing in regards to community outreach to sort of rebuild that trust with the minority communities, to get vaccinated and such?
I can go. So, for example, this is a first phase of doing that to kind of have a presentation for people who are embedded within the Black community, to know that this is an excellent resource where we can dispel a lot of the myths. That we are still discussing ways that we can be more efficient in partnering with different community organizations that work within the Black community to kind of reconnect or rebuild that trust that might not exist, so that we can actually start the conversation and just make sure that people know that this is accessible and they can utilize it.
I wish Matt was here too, Alejandra. I will say, when I say that they have made themselves available, Dr. Fuller and Robertson both have incredibly full schedules, and just in the last 2 weeks got a request from Matt Green and they figured out how to make it work and have been so flexible. And I know that the team in public health has done so much outreach to like our community health clinics, La Clinica, other Medi-Cal providers, going out into apartment communities. Any organization who wants a presentation can put in a request, and they have just made it work. And so they'll pretty much talk to anyone who wants to listen. Even Bela, Dr. Matias, he's our actual public health officer, and he has made a conscious effort to once a month, for example, Choice and Aging hosts a town hall where people who would normally not even know who the public health officer is or think it's one of those professionals up in the glass house, right, like unattainable, he's made himself available to ask questions directly and take the heat and everything. So if you know of a community who wants to hear information, you can reach out to me, you can reach out to County Matt Green or even Robert,
Thank you.
and we'll connect you with someone who will respond. And
That was a good question. Thank you for asking.
And I just want to, let everybody know that Office of Assemblymember Tim Grayson is here to serve our community, and we want to be of assistance, and we just want to really be there to help in any way that we can.
Thank you.
so I'm going to I've been trying to figure out how to share my screen this whole time, and then we made it. They're sharing their screen just
Okay,
fine.
let me stop my
No, you don't
share.
have to unshare. It's just literally is stuck. It's telling me, no, thank you. So I am going to put my name and email address in the chat for everyone, and my phone number, so that should you have any questions, you can also, reach out to me and then I can forward you on. Oh, I just gave you my name. But also I can't share my slide for our program. So one of the things that's important for any of you who have older adults in your whether they're clients, family members, friends, neighbors, if they have a question or need access or need service, really that's what Choice and Aging is here to do, is to connect people with people who have the answers if we don't have the answer. So I want to make sure that that really we're here to help, and we have a no wrong door policy, and we'll help you. And if we don't, if we can't, we'll find the people who can. That's just our philosophy of business. So, but I want to give you a couple more minutes while I'm putting my information in here. Ask any other questions that have come to mind, share any other concerns. Please, trying to see if I missed anything. So everything in the chat looks to have been addressed. So now you're on your own. You have to speak up now. And thank you for being here. And thank you to our presenters. You are fantastic. I appreciate, it was really easy to listen to you, and it was such incredible information. So thank you for letting us record this too, so that we'll get lots of ground with your time.
And the resources that we had in the links, I will send you the links itself, so that if anybody is interested, they can email you and you can forward it to them.
So my name and email and phone number are in the chat. I'll just go ahead and just verbally tell you too, for those of you who may be taking notes. So my email address is tstacy, so TSTACY, no E, at choiceinaging.org. And the best way to reach me is 707-628-9805. And then that way, if you need information about our program, I can get you set up with our intake coordinator. I can connect you to county, whatever you may need. So thank you so much, everyone. Thank you for your time. Going once, going twice. I think we're good. There's lots of awesomeness coming in the chat. So thank you again to the presenters, and enjoy the sunshine. It is gorgeous. Winter decided is never coming. So let's just enjoy our spring. Our spring is starting here. Get your vitamin D, and thank you guys. Stay healthy and stay safe.